Hi, I'm Dr. Katie Chobot at Covington Veterinary Hospital, and I'm here to talk to you about what to expect for your dog's neuter.
What is a neuter surgery for dogs?
Yeah, the neuter surgery includes removing the testicles for dogs so that they're not able to reproduce.
And why should you neuter your dog?
There are a lot of benefits to having your dog neutered. First, I think, is population control. Certainly, we do have issues with having too many dogs in the world, and so really having your dog neutered is responsible for population control. There are health benefits as well. When we remove the testicles, we eliminate the risk of testicular cancer and we reduce the risk of prostate disease. But then there are behavioral benefits as well. So our dogs that are neutered, they tend to have less aggressive behaviors, less marking behaviors, and they tend to be better pets for our families.
And what are the risks of neutering your dog?
I think the biggest risk for neutering your dog is that with those testicles gone, the hormone testosterone level is going to drop, and metabolism kind of goes with it. So the biggest complication I see is weight gain, but that can really be easily managed by limiting calories after their neuter surgery. The other thing to be concerned about is just making sure they don't lick that incision and cause an infection at the surgery site.
What age should you neuter your dog?
Generally, I'm going to recommend that you neuter your dog by 6 months of age to get all the health benefits, but also to really reduce a lot of those behavioral changes like marking behaviors that you can see occurring. But there are some instances in large and giant breed dogs that you might consider waiting until they're a year and a half or 2 years of age. And certainly that's something you can discuss with your veterinarian to decide what's best for you and your dog.
And what does the neuter surgery include?
Yeah, the neuter surgery includes an IV catheter and fluids, of course, anesthesia and a technician dedicated to monitoring them. They're kept on a heated water blanket to keep them warm, and they get all kinds of pain medication to keep them comfortable. It does include the doctor scrubbing in sterilely with a gown and gloves and cap and mask, and we have sterile instruments and a sterile drape, and it includes the surgery to remove the testicles and then lasering afterwards to help speed healing and reduce pain. And then they generally are going to go home later that afternoon to you.
And then what is the neuter surgery recovery like?
Yeah, the neuter surgery recovery, I think the biggest thing is to prevent licking the incision after surgery. So that may require an e-collar or a donut or like the inflatable collar or a surgical recovery suit. And all of those are tools you can use to prevent your dog from licking the incision. They also need to stay quiet for about 7 to 10 days so that surgery site can heal. And that means leash walking outside, no rowdy play, and trying to keep them quiet as you can. That may mean using some extra enrichment with food, frozen Kongs, and lick-it mats and snuffle mats, and going on extra long sniff walks to keep their mind busy while their body is resting and recovering from surgery. Yeah, and if you have any further questions, feel free to contact us at Covington Veterinary Hospital.